My name is Andrew Poveda. This is AP Med, and we're going to be interviewing Dr. Devin Barzallo. And from what I know, you are a PGY1 at Chicago as a dermatology resident, correct?
Yeah, so for dermatology, it's 4 years, and the first year is a medicine year. So I'm in my medicine year right now in Chicago, and then I go to the University of Michigan for dermatology.
Okay. Yeah, good to hear. Do you want to introduce yourself a little bit? Say things that.
Yeah. So my name's Devin. I grew up in New Jersey. I was born in Jersey City. I moved to Elizabeth, and then I moved to Colonia after that. So I spent most of my life in New Jersey. Then I went to Rutgers for college, for undergrad. I studied biology and psychology there, and then I applied to med school in 2020 during COVID, and I went to Case Western for medical school. So I've been in the Midwest since, and I'll be spending at least 10 years here, so I'm really excited about that. I really like it over here. And yeah, my family's still in New Jersey, but I have family pretty much all over the world.
Oh, wow. It's good to hear.
Yeah.
And you're Ecuadorian, correct?
Yes, I have. My mom has 11 siblings, and like half of them are still in Ecuador, if not more. And then my dad has 6, also like half of them still in Ecuador.
Huge family, yeah. A lot of Hispanics have a bunch of brothers and sisters, and yeah,
I know. I have many cousins. I have many cousins that I have never even met, so it's a really big family.
It's like that, yeah.
Yeah.
All right. So, do you want to talk about your undergrad experiences?
Yeah, like what I did in undergrad.
Yeah, just quick summary. Break it down for us.
Yeah. So for undergrad, I was pretty involved with. It was called ODASIS, Office of Diversity and Academic Success in the Sciences. It was a very long acronym, but it was really nice because you were with like other Latino and Black students, and you basically went through all like the science courses together. There was teaching assistants. So Dr. Khan ran that at Rutgers, and he's like an amazing resource. And then I did TAing for that at some point, like during the latter half. And then I also volunteered with the Children's Hospital at Robert Wood Johnson, and then also worked with one of the homeless shelters in New Brunswick. So those were my main activities. There was like I forgot the name of it now, but there was like an advocacy group with the American Cancer Association. So there was some work that I did with that as well. And then, I did research. I did a lot of research. I was like, what else did I do in undergrad? It was called NERA, Northeast Regional Alliance, I believe, at NJMS, the medical school in Newark. And then I did Columbia Spurs, so up in Washington Heights, doing basic science research there in a cardiology lab. And then I also did the Rusty research grant through Rutgers as well, through the Department of Psychology. So I did research, community service, advocacy, to try to get I loved my time at Rutgers. I loved like the liberal arts education, taking philosophy courses, law courses, like really getting a well-rounded education. And it was a very diverse campus. I really liked it.
That's good to hear. Yeah, I was waiting for you to bring up your research because I see I looked at your LinkedIn beforehand, and it's a bunch of research. It's a bunch of fellowship. Well, you were a fellow in a bunch of different places. Yeah. How was it like trying to get that experience? Like, did you have a mentor to help you reach those, or did a professor lead you to getting those research opportunities? How was it?
Yeah, I think a lot of academic medicine is really mentorship. So as an undergrad, I'm first gen, so I didn't really know many people. But I always went to like every office hour for all my professors in my classes. And then one of my professors, Dr. Howansky in the Department of Social Psychology, I really loved her course. So I like reached out to her after, and she was a graduate student in the Department of Psychology at that time. So that was actually my first like lab experience. And I think I was like a second year undergrad student at that point. So through that, Dr. Shanna Cole as well was like the head PI or the principal investigator of the lab. So through that experience, like doing research in the lab, I was able to get letters of recommendation for some of these like other fellowships. So for like Columbia, like they were one of my letter writers, which is really important. And then one of my professors like wrote the second letter. But for the Northeast Regional Alliance, I think it's called NERA. I'm like blanking out on everything.
Yeah.
That I like didn't. I think we had to submit letters of recommendation, but like I just had like no one at that point to like submit it. I think I was like a first year college student. And they took me anyways, which was really surprising, but it was like nice that I got in. I also did EOF, like the Education Opportunity Fund through Rutgers. So I think, which is like for low income students. So I think that helped me a lot. Like that was on my application because they all like know each other. So I think somebody probably vouched for me like on a back door because I didn't submit the letters.
Yeah, it seems like Rutgers and JMS, they're like a really tight group. They really support each other from what I've seen. So
oh no, I loved it there.
Yeah,
it's really nice. The community's like great in Newark as well.
Yeah, it is. Have you tried the food trucks around there, the halal trucks, and they're really nice.
I haven't actually. I'm trying to think of what I did. See, I like grew. So when I always commuted. So I would just like go to work or like go to lab and then just like come home and like eat my parents' food. So I had never had the food trucks there actually, but maybe when I go back to visit my parents, I'll try it.
Yeah, you should try Bruno's. That food truck. It's a yellow truck in front of the hospital. It's really good. That's like the one thing I'll remember from like the food spot from there.
Okay.
That one spot. Yeah. You gotta try it.
I'll check it out. Yeah.
Okay. So, how was it applying to medical school?
That was also like such a journey. I had no idea what I was doing either. So I was doing research in New York, like my junior year summer. So I knew I was going to take the MCAT at some point. I honestly was planning on taking it in August. So that's when I booked it for, like at the end of that research. So I was like studying for the MCAT, like after lab. I remember like having the Kaplan book, like reading it on the bus between like Morningside Heights and Washington Heights. And then I spent like a whole month after that, like all of August basically just like studying. Like I didn't go to work or anything. I literally just sat home and like studied probably like 12 hours a day without like seeing anyone. But it was a lot. And then I obviously took a lot of like biochem courses, Orgo, all that. So I think it really helped me like prepare for MCAT, like just through my college courses. So that was my biggest hurdle, like taking the damn MCAT. But once I took it, I got my score back. I was happy with it. I decided to apply like pretty late. So that was, that was also interesting because you need like a committee letter when applying to med school. So like Rutgers didn't write me a committee letter actually. Because I like missed that. I like missed the application deadline. I was like, oh my god, like this is the end of the world. And like I remember going to the I forgot the name of it, but the health office, whatever, at Rutgers, and they're basically like, yeah, you probably won't get into med school like this late, whatever, blah blah blah. But I was just like, let me just shoot my shot. Like, why not? Like, worst case happens is I just apply again next year, and like it was fine. It was actually, and I forgot the name of the other program, but if you took the MCAT and you were like low income or URM, you could like click a box, like schools could reach out to you once they get your MCAT score. So a bunch of different like universities had reached out to me. I didn't make much of any of them because I figured it was just like spam, that they were just like recruiting like whatever, but it didn't feel like personalized to me at all, like in any way. Yeah. But there was at Northwestern, there was like a phone number or an email. So I like emailed them, and then I got on the phone with like the dean of diversity at Northwestern, and he was like, definitely apply this year. I think you would make a great candidate. Like, just shoot your shot. So that's what I did. So I applied like literally November. I don't recommend anyone to do this. Like if you have any inkling that you're going to apply that year, like just apply on time. Because you could always apply and then wait till you got your MCAT score and then always like withdraw. Versus instead I got my MCAT score, waited for my results, and then applied. But it worked out. I really wanted to stay in the Northeast originally. So and all the schools in like the Northeast were like basically closed already. Like all the New York programs were closed. Like the rest of I was able to apply to the Rutgers ones. And then I got an interview at NJMS, but like Rutgers, New Brunswick didn't interview me probably because I didn't have a committee letter. But like it worked out. I got interviews like in the rest of the country. I got some in the Northeast, like it was like Brown and Georgetown, but like mainly like South, West, like West Coast.
Can I interrupt you? Sorry.
Yeah.
You said that Rutgers NJMS gave you an interview, but I guess Robert Wood Johnson did it.
Robert Wood Johnson did it, yeah.
Wait, I'm under the impression because I've looked at NERA. I'm currently applying to summer programs right now, right? And NERA, they give you a cover letter, or they give you like a letter of recommendation, right, for the medical school. Or I've heard something along those lines, right?
I don't remember. I think they did offer me a letter of recommendation for New York. I don't know if I actually used it or not. I can't tell you or not. But the issue is like for Rutgers, Robert Wood Johnson, since they got so many applicants from like Rutgers undergrad. And I like spoke with the dean there as well. They were basically like, if you don't have a committee letter like from your undergrad like endorsing you, I think that's why they didn't interview me. But NJMS actually did interview me, so I was happy about that.
It's good to hear. Yeah.
But it was literally a mess. Like I had no idea what I honestly like don't know how to even apply to med school these days. I feel like there's so much that changes. Like there's Casper now I hear, and like I mentor some pre-med students, and it just seems like everything's just so like arduous. Nothing makes it easy, but I did do the fee assistance program, and that helped a lot to cover the cost of applying to med schools. And they also gave me like the question banks for the MCAT as well.
So how do you find out so many of these resources? Like you mentioned the fee assistance program. Like I'm also first gen, so I understand the struggle of trying to find out a bunch of resources. Like I know specifically studying for the MCAT, people have talked about the Miles Down Deck or on Reddit, UWorld, what else? Jack Weston. There's a lot of free resources out there, and you just have to know where to look. So how have you kind of navigated and looking?
So that's what was really nice about Odasis was they made it really easy for me in terms of being like, oh yeah, like apply for the fee assistance. Like we would get emails from Odasis like through a listserv. I'm just in charge of it. So they told me what to apply for, which was nice. And that's how we even found out about like some of these like summer research programs. Like through Odasis. And then I also did EOF, which I mentioned before. So they had a bunch of opportunities and things like that. Like I remember they gave me money to like pay for like some other like study resources like the Kaplan Test Bank, and there was like money to get like a suit for interviews as well. So like I definitely just tapped into any resources at my local university. And then like knowing, because at my med school they did send out like a lot of like opportunities as well, but like going through that process in undergrad of applying for all these fellowships, applying for research programs, like it made it so much easier to do that at med school. Knowing I could do like research outside of my institution and things like that.
How did you go about contacting other institutions for research opportunities and things along those lines? Because I know a lot of students in Rutgers, New Brunswick specifically, since they're down like the Philly area and they're still pretty close to New York City, they go towards New York City or Philadelphia more than Rutgers typically.
Yeah, I mean, I definitely did do my research at like Rutgers, New Brunswick, and I think it's important to do research at your home institution because you do want someone to like be like, because it just sounds like a better letter of recommendation if you're like, oh yeah, this person was in my this person was in my course, they did really well in the course, they went to office hours, they did research in my lab. So I definitely would utilize like the resources at like your home institution, and then, but it is nice like being in New Jersey, like New York's there, like you mentioned. So I did do research there, and it was like nice to live there because I've always wanted to live in New York, and then I lived there and I was like, oh, this is like really stressful. So but it was like fun to live there when I was like 20 or something, and like just like experience all like the diversity of things to do and the food. So like I'm happy I did that, and then I was able to live in New York again as a med student. So yeah, but yeah, I definitely just like email these people. Like you could cold email them if there's something you're really interested in. I always tell students like find something you're really passionate about research wise, and then see who's doing research on it. And there's usually someone at one of these big academic centers doing research on that. And people are always like happy to take on students. But the way I did it most of the times was through these like formalized research programs, because then they like paired you with a mentor. And they also gave you funding, which was super important for me. So they would like pay for you to do research. They would give you free housing. They would pay for your transportation. So I recommend that to like any first gen low income student or any like URM student, underrepresented in medicine, to really like take advantage of the resources out there.
Okay, so on a little bit of an unrelated note, I had a question about, I saw this TikTok from another, not from you, but from somebody else. And it was talking about how you could do research in, I don't know if they were talking about undergrad or medical school, but they were talking about a bunch of databases, SEER, FAERS, NHANES, PubMed, and a bunch of other, a bunch of places you could pull data from, and you could publish your own research. Do you know how I would go about that if I wanted to? Because I know you don't have to necessarily do what would it be called? Bench work. You don't have to do bench work. You could just pull numbers from different articles and then conduct it together, bring it all into one place, do an abstract, summarize it, and notice trends. So how do you know how to go about that? And
so those are like the large databases, and they're super helpful. I did research with NHANES and Sears, like as a medical student. You could definitely do it as an undergrad as well. I always say like find a PI though, because you don't want to do research on your own, because it's like, one, if you want an expert in like the area that you're searching for, because they could always be like, oh, give you a different perspective since they're like doing research on that or have clinical expertise. So they could be like, oh, have you considered this? And they really help like guide you. Because I never think any like pre-med or med student should do research on their own. So like, but that's a great way to do it. Be like, oh yeah, I looked at the Sears database. Like this is a research proposal. Like we could look at the association between like hidradenitis suppurativa and like the effect of like biologic therapy on that. And just see if there's any like trends or associations with it. So in those cases, I would be like, okay, let's reach out to a dermatologist who specializes in hidradenitis suppurativa, because they could tell me like things that are comorbid with it, or like looking at if they have a history of smoking or anything else that puts a patient at risk for hidradenitis suppurativa. But I love those databases because when you do it at an individual institution, like a chart review and things like that, it's just one institution, whereas these like large databases are like 20, 30, 40 universities or hospital systems. So a way to find it is just like try to see what you're interested in. Maybe it's like affordability of like groceries in a specific area. So there's like, I know there's some database about like food security. And then you could see how that like associates with, I don't know, some other factor, and then that could be your research question.
Yeah, I feel like there's a lot of ideas of what to research, but trying to find the numbers to put together, that's definitely a lot of the hard work.
Yeah, and I've definitely been through it, whereas like I have this research question, I don't know what database will answer, and then I'm like looking through 10 different databases. And then none of them have that. Like I was looking at like limited English proficiency, and I think like NHANES had it, but Sears didn't. But then it didn't have the other factor that I was looking at. So like I wrote a manuscript up about it, but like at the end of it, I'm like, this is something that's needed in a future like iteration of NHANES or Sears, or maybe another database can capture like English proficiency, because none of these large databases are currently doing that. So it could be like a future next step, like, and that's how change happens. Like people do research. There's maybe there's no way to answer that, but that's why we need other tools to answer these questions.
Yeah, are you talking about the melanoma one that you?
Yeah, I published in melanoma, like disparities, specifically looking because we know about it in like racial, like ethnic differences, and that's mainly because a lot of patients with acrolititious melanoma are usually like African American or Black, and that's a more aggressive subtype, so they usually have a larger disparity there. But in terms of English proficiency, which my question was like, would they have access to even get like healthcare screening? That's the question I was answering, but it was really hard to do so with the current tools available.
Could you talk about some data research sites, databases that I haven't really mentioned yet? And
there's Trinetics. I really like Trinetics. That one's really useful, and it's like pretty intuitive to use. Your university has to have an affiliation with it. I'm sure Rutgers does, since it's like such a large research university. And you're at Montclair and Rutgers. Do you have an affiliation to NJMS already?
No.
Or do you have? You have to wait.
I have to wait. Yeah.
But I'm sure Montclair does a lot of research too. And if not, you could always reach out to like a PI at a university who has Trinetics as well. And they can get you onboarded. It's pretty easy to do so. But Trinetics is like one I've been using more recently. And it's like, that has like millions and millions and millions of patients, like aggregated information.
So it's a bunch of clinical data on these patients?
Yeah, it's basically a bunch of clinical data on like all patients. And they do it by ICD-9 codes, which basically like if you go to a hospital and let's say you're there for like cellulitis, they'll put an ICD-9 code for cellulitis. So then people can identify like a patient who had cellulitis through that ICD-9 code. And then you can check like everything else about you. So it would be like, oh, this person had cellulitis when they were like 27, they're a male, they're Hispanic, other comorbid things that they had. Like if I had any other like ICD-9 codes associated with my like patient chart, like diabetes or hypertension, things like that.
Got it. Got it.
Yeah.
Oh yeah, I've been meaning to ask you this question. So, what's your opinion on healthcare professionals with a social media presence or a type of digital footprint? Because I know you have a good following in the medical field. So, what's your opinion on that?
Yeah, it's like kind of controversial because I see a lot of residents telling med students, like especially during application cycle, to get off of like social media, because even if one person has a negative bias against it, that can kind of tank your application, especially in like competitive specialties. Um, they like some programs will find any reason to like rank someone lower. So if one person doesn't like you, there's so many people who want that spot. So like a lot of people have been dissuading people on getting on social media. I find it as like a really useful platform. Like I've used it as a way to like combat misinformation out there. There's like other healthcare professionals who I just think are giving like blatantly false, harmful things, like saying the vaccines are what did this one say? Yeah, this one family nurse practitioner wrote that the H1N1 vaccine was experimental, and she has like over 100,000 followers.
Oh wow.
And then someone else is mentioning that ivermectin needs to be in every cancer therapy regimen, but there's obviously no evidence for that or no clinical trials that are showing that. And these are all healthcare professionals that are saying this. So I think it's really good to have not only like doctors at academic programs, but also like these large academic journals. I think they should play a role in social media more to like make videos digesting what the research out there is. Because sometimes I'll like, when I'm discussing my point with people, I'll cite my research, but then a lot of the times if you don't have the medical education training or research training, if I send someone a New England Journal of Medicine article, it's really hard for them to even break it down on what that means. So sometimes I'll like comment on people's posts and like try to like, make it understandable for a large group of people. But I would love if like journals did that more, as well as like any other academic position. Because unfortunately there's like a big gray zone of people who are just trying to make money off of a system. So I think that's why like physicians actually are really helpful. I think as trainees, it's always difficult. And I've even been like called into my program director's office because someone didn't like what I posted or something. Which is obviously just stressful from a trainee perspective, like to even have to like do any of that. It's like getting called into the principal's office when you're 27. Yeah. So I think it's great. I think it's a tool that I use to connect with first-gen students, low-income students, Latino students, how I'm on this podcast now. Mm-hmm. So I think it's like a wonderful tool, and it can be used if used properly, but a lot of people use it to unfortunately just make money. And I like to call out these like individual actors, when people are trying to charge students for mentorship, it just seems antithetical to like the mission and ethos of medicine. Like I said, all these people wrote me letters of recommendation to apply for all these programs, to apply to med school, to apply for residency. And never have I ever like paid anyone for mentorship. So that's something I really like to talk about on social media as well. And then obviously I don't like students getting scammed, period. So I've talked about like predatory research, how to like do good research practices, avoiding any organization that tells you to send them money via Venmo, like to publish a research article. And like, there was like 3,000 medical students in this like organization, which is just really bad for research. But I think it's a good way to talk to trainees about like how to do research, and then talk to patients on like, vaccines aren't bad for you. Tylenol isn't bad for you. Just try to combat some of that misinformation.
Yeah, I feel like there's a lot of information online you don't really know who to trust exactly. And I remember I was shadowing this doctor, and he brought up the debate of just because you give a patient informed consent, well, legally it is informed consent, correct? But this informed consent to the patient, it isn't fully informed consent because these patients don't have the medical education to fully understand their condition. So how do they know the next steps they're supposed to take, or how fatal their condition really is if they don't have the medical education behind them? So my question is, how have you dealt with adversity as a Hispanic, as an advocate for the LGBTQI community, in overcoming these obstacles of people? I know a lot of people who look down or try to discourage Hispanics or minorities in general from entering medicine. I've even seen you're part of a dermatology residency now, or you're about to enter it, and there's people that talk about how just because you have something like acne, that means that you shouldn't try to even apply for dermatology residency, because who trusts a doctor who has acne, or a doctor that doesn't quote unquote listen to their own advice? So I know it's a long question, but let's break it down one by one. Sorry.
Yeah. I mean, you're similar with New Jersey. So I was born in Jersey City. Then I moved to Elizabeth. So these were like large, like migrant communities. So I was always aware of like social justice from like an equity standpoint, because I just saw poverty around me all the time. I saw people being mistreated by the medical system, or just being, exploited for their labor really cheaply. So that's what drew me into medicine. And obviously a lot of those systems want to keep me away from pursuing medicine. But honestly, like through all my mentorship, like that's what really got me through everything. Like I can't even think of a time when someone was like, you won't become a doctor. Because all my mentors have truly like been so supportive of me. And without them, I would not be where I am. Even when like the health equity or the office of like students going into medicine at Rutgers, he was like, it's not that you won't get in this cycle. I mean, it's not like you won't be a doctor. He's like, it's just going to be next year. Yeah. But he was like, your application's great, blah, blah, blah. So everybody has been super supportive of me. So I'm not going to even act like I have that story, because I know a lot of my other like Latino friends or Black friends, like a lot of people have told them they're absolutely not going to go into medicine because of XYZ reasons.
Yeah.
So I know that's a lot of people's truth, but honestly, I can truly say I've been so lucky and fortunate that I have had such great, wonderful people in my corner the whole time. I will say, going into applying into dermatology for residency, a lot of people are like, oh, like you need a certain score, or you need XYZ things. And I didn't like have those things. And I obviously was very successful in my dermatology application. So I think the main thing I try to say is really find people who can advocate for you and be in your corner. Because medicine is actually really small. Everybody kind of knows each other, especially in like smaller specialties. Mm-hmm. So like having mentors who are calling programs like to advocate for me, and like, no, he's like a really great guy and he's like going to do great things. Like that gets you really far. Like the thing that differentiates students is not honestly how much they know, because you can teach most people medicine. It's who they know. So that's why it favors, people who have connections and everything like that. But if you're a very young, smart, ambitious, like Latino or Black student, I think just reaching out to people, even if 99 of them say no, like I don't have time to mentor you or whatever, as long as one person, responds to you and sees your worth and your potential, you'll go very far. And then, yeah, I mean, honestly, in the clinical setting, people have said crazy things to me, either because I'm Latino or gay or whatever, like patients, like clinicians, blah, blah, blah. But I know my why on why I'm going into medicine, and I think about all the people that I can help at the end of the day. So that's what keeps me going, honestly. I hope that answered it. I don't know. That was a long-winded answer as well.
That did answer it. Yeah. You're good. One thing you brought up that I completely forgot to ask at the beginning, but why medicine? Why did you choose to pursue medicine?
Yeah, kind of what I just answered. Like, I knew from a young age that there was like healthcare disparities, and it's like, this is a very common answer for a lot of Latinos, but it's like I went to the doctor's office with my parents and I was translating for them. Mm-hmm. And I just knew like that was my interpretation of healthcare at that time. And then I just always like thought I was going to be a doctor, like ever since. And like I said, everyone was so supportive of me at Rutgers that it was like very easy to find research, very easy to do like basic science. So I just kept with it. Like I had that idea as like a 5-year-old like child, and like I just kept with it. And I always like I see a lot of Latinos, like even my own cousins who like were pre-med and then they like switched to something else, or they thought they didn't like they got a C in a class, so they felt like they were just like excluded from medicine completely. And I just try to encourage people that like nobody's perfect. People are going to have C's on their applications. Not everyone's going to have a 520 on their MCAT. Just like be the best version that you can be yourself. And like people need Latino doctors. Like there's a huge shortage. People need doctors that speak Spanish. So I just felt like that this is like a career that I can make a positive impact in. And I'm happy I stuck with it. Yeah. Because it's like the best job ever, honestly. Like I'm really happy doing what I do.
Yeah, I could tell that you really enjoy it. You sound really passionate, but
yeah.
I'm gonna ask this question, and you might already know the answer, but how have you dealt with imposter syndrome? Because you seem like a very confident person. So have you ever had doubts in your career? Because like you said before, ever since you were 5 years old, you want to become a doctor. But have you ever had moments where you're like, oh, I got a C in this class. I did bad. I missed the application deadline, like you said before. You seemed like you were hesitant.
Yeah. Yeah, I remember like crashing out many times during college. Mm-hmm. Like I got a 60 on like a physics exam, and I was like, "This is the end of the world." Blah blah blah. But then, like I said, I just went to every single office hour for that physics course, and then I got my grade up to a B. But since I literally went to every office hour, like I like begged him if I could get a higher grade, and then he gave me a B plus. So I remember just like, I think if you're first gen low income, you really just need to do everything you can. And that means going to office hours. That means like not going to like the parties and stuff like that. Because if you truly want to be a doctor, there's a lot of things stacked against you. So I always like tell any like Latino student or first gen student, like take college very seriously, because the higher your GPA is, the more likely you're to get into med school. But that doesn't mean if you have a low GPA that you should exclude yourself either. But when I say like put your best foot forward, that's like exactly what I mean. Like go to the office hours, really try hard. And I think when I was applying to med school, I was also like, oh man, like I'm definitely not going to get in this cycle. Like I'm applying way too late. I gave myself like, I was ruling myself out before I even applied. And it took one person to just tell me to apply to actually do it. And I'm happy I listened to him. And then as a med student, I was really nervous to go to Case Western for medical school. I was like, oh, all these people are like super smart, blah, blah, blah. Like everyone who's in medical school is like a super genius. And I don't mean this like in any way, but I got there and it was like, oh, a lot of these people like are legacies from Case Western. Like a lot of their parents went here, and that obviously helped them get into med school, or they had other physicians who helped them through the cycle application. And I was literally like, I winged this whole thing basically. Obviously I had help from many mentors, but I was like, if I got here and they got here and we're both here at the same place, despite me like growing up low income and things like that, that kind of like took away the weight of imposter syndrome. And once I was there, I realized we all had access to the same resources and opportunities here. And since I didn't grow up having these opportunities, I really wanted to seize like everything I could. So that's why I did so much during med school. Like I spent a year at the NIH. I went to like MGH to do basic science research. I went to San Francisco to do research in HIV. I went to New York to do research in infectious disease because I wanted to use my time at medical school because I only had 5 years there. I wanted to make the most of it. And, you know, you only do med school once. So I really wanted to like learn from the experts and the things that I wanted to do and really follow my passions. Because when I was in college, it was kind of like, I would just take any opportunity that I had. But during med school, you really get to like shape the medical education that you get. It's like less begging for scraps than I feel like college trying to get into med school.
Like they say, getting into medical school is half the battle.
Yeah. I honestly think getting into med school is harder than doing med school. Because I remember being so stressed out. And like college, obviously, everything was graded. If I got a B+, I was literally crashing out. Med school, for the most part, most med schools are pass-fail. Step one was pass-fail. I feel like a lot of the things was just like to pass. And I could really focus on like my extracurriculars and doing things that I think made me a better doctor than just getting a high score on an exam.
Oh yeah, earlier you mentioned that you've moved to a bunch of places. Like you went to Ohio for Case Western, but you're originally from New Jersey. Then now you're in Chicago. So I asked this question: have you found it difficult to find a community in the places you've moved to, and how have you navigated that?
I mean, Rutgers was so nice because it was like I had Odasis, I had EOF, so I had like a group of all Latino Black students, first gen students, low income students. So I literally just felt like so at home at Rutgers. It was so easy to find community there. Case Western, we also had the Latino Medical Student Association, and SNMA, the Black Medical Student Association. So like I really found community there really quick. I did like leadership and the executive board there. So it was really easy to find community in med school as well for me. And then I joined the like Midwest board and the national board for the Latino Medical Student Association. So like I met Latino students from literally all over the country. So now I basically know like most Latino medical students in the country. And it's just great. It was so nice working with everyone. And we really, I thought we did a great job. Hosting conferences and getting students to know about different specialties. In terms of Chicago, I moved here, my fiance's here already, and then my family in Chicago as well. And then my co-residents are so amazing, and I feel like we just all get along so well together. So it's also been super nice. And I'm sure I'll find community in Ann Arbor as well.
I've noticed that there's a lot of, well, in competitive specialties like dermatology, anesthesiology, you have to have, well, you don't have to, but it's basically like a hidden requirement where you have to do a research year and you have to have a lot of publications to match into these competitive specialties. So what's your opinion on that? Because I've heard online opinions of, conflicting opinions of people saying that, physicians are meant to be clinicians, so why are they doing so much research? They might as well just do a PhD at this point. That's the argument I've heard online. So what do you think about that?
Yeah, I mean, I did do a research year. I did at the NIH, and I thought it was a very I had the best time there, and I learned a lot. I learned how to be a better scientist, and I think ultimately a better clinician through that. I think I always tell students, because a lot of students ask me if they should do a research year, and I'm like, if you have to ask me, I feel like you want me to convince you to do a research year. And if that's not where your passion lies, if your passion isn't in research, I don't recommend students to do a research year, because I know plenty of students who match into those specialties without doing a research year. So when I tell anyone if they want to take any year off, if they want to do an MPH or even a PhD and things like that, are you going to use it in your future practice / will it inform your practice and make you a better physician? And if neither of those two things are true, then I don't think you should delay your training, and I think you should just go into the clinician workforce. I think there's a lot of fear mongering that you need so many publications, blah, blah, blah. And the AAMC actually just changed on ERAS. They didn't cap the number of research publications, but now it's grouping it. So basically, if you had 3 abstracts presented on a very similar topic plus 1 paper, now it would just be 1 item instead of 4 different ones. So I think that would be a positive change. It will deflate the number. I think people should have been doing that beforehand. I don't think you should have been I mean, it's great to present the same research at different conferences, because then you get feedback from different people and then you can make your paper better. But I don't think you should be listing it as 4 different things. I think it should just be 1 item. So I'm happy the AAMC is making that change. And now it's also going to highlight what's first author publication. And then you have to write what your most meaningful research experiences were. So those are all really positive changes happening in 2027 according to the AAMC. So that's where my passion lies, because I know there's a lot of research organizations out there that are charging students just to get their names on papers, which is really unfortunate, because that's not how research should be done. It's teaching students for research qualities and traits. So I definitely don't buy into you need the research year or you need anything a certain number of publications. I know a lot of people matched into really great specialties, really great programs with the case report, because they had other things that are going for them. So one thing I always tell students, it's a holistic review. Every dermatology program, at least that I interviewed at, did holistic review, meaning that they cared, yes, about your step score, yes, about your clinical scores, yes, about your clinical comments, your letters of recommendation, but also your community service, your advocacy, your research, and then everything is scaled depending on the program. So some programs that really care about research, obviously they're going to weight research more. Let's say they give it 10 points. But some programs are probably only going to give it a weight of 5. And I think it makes sense when you apply to these like large research universities for you to have some sort of research background. I think there's a lot of places that aren't research heavy and they don't do a lot of research at their institution. So I agree, it doesn't make sense to do a research year or PhD and go into one of those programs, unless that's where you really want to be and you really want to train and you understand you'll be foregoing some research infrastructure to go there, but you'll get great clinical training. So I'm never here to tell someone where they should or shouldn't go. But I understand why these like large research universities want research clinicians, because they want them to stay in academia and go to different institutions and start programs there and do research there. And research is extremely important. So I don't think we should get rid of it, but I think it should be devalued in the sense that a dermatology applicant should not have 50 research publications. Like, that doesn't make sense to me. I always say a really competitive applicant has like 1 to 2 research publications a year, because realistically you can do 1 to 2 publications and, maybe it's not Science or New England Journal or Lancet or anything like that, but you could probably do 1 to 2 research publications that are high quality a year. I think when I applied to Derm, I had like 6 publications or something like that. And I did it was a lot of work, but I also had a research year built into that too. So, yeah, but there's like so many programs that don't do research. So I don't understand why someone would do a research year and go there. But obviously dermatology, there's so few spots that people, are willing to, sacrifice, even if they have a research, like an area of research interest. But also, like I said, you could always cold email people. You could always do collaborations outside your institution. So I don't know. I don't think it's fair to expect trainees to like dedicate 1 to like up to 7 years just to get into a specialty. I saw someone applying to dermatology for like the 5th time on like Instagram today. I was like 5 times applying into dermatology. Like it's a very unfair process.
I didn't really know about that, the change that the AAMC is making in 2027, because I've heard of a lot of spam papers that are being put out right now.
Yeah, it's like spam papers, like for dermatology, there's many conferences, but everybody knows about the pretty big ones. Like there's the American Academy of Dermatology, SID. There's some smaller conferences that always go there. The Skin of Color Society. So there's these like big conferences that people know about, but I don't know. People are like making up conferences nowadays. Like, I don't know. It's crazy. To charge students, nothing makes sense anymore.
Yeah, I've seen a lot. In terms of dermatology, could you just tell me what it covers? Because whenever I hear dermatology, I'm thinking skincare and sending people home with acne medication, or what's that one pill called?
Tretinoin.
No, not tretinoin.
Or spironolactone, doxycycline.
No, there's this really one known pill on TikTok. It's Accutane. I'm thinking Accutane.
Yeah, Accutane.
Yeah. So could you just give me a rundown summary of what dermatology is?
Yeah. So you like got a lot of it. So it's hair, skin, and nails. So you talked about a lot of the skin stuff, but we also specialize in hair and then also the nails. Most of it is outpatient for dermatology. There are some inpatient dermatologists, but it's usually like a consulting service. So basically, internal medicine will have a patient, and then they will consult dermatology if they have any like specific dermatologic condition or issue that they need help with solving. So luckily, from a derm standpoint, we never really are the ones that are like, you can't discharge the patient. Sometimes we'll be like, oh, we want them here for a little longer for any reason. But ultimately, the primary team like decides that. So I'm doing my internal medicine year right now. So that's a lot of the things that we decide on internal medicine. And every day on rounds, like one thing that we're always considering, because we don't want patients being in the hospital longer than they need to, is their like disposition. like, where are they going to go? Are they going to go home? Are they going to go to a skilled nursing facility? Are they going to go to acute rehab? So we really want to optimize them medically as much as we can, but we also we understand like no one wants to be in the hospital. We want to prevent deconditioning. A lot of patients are just like sitting down like all day, so this isn't their regular environment. So we talk about those things every single day, and we talk with our different consultants on when it's appropriate to send a patient home. So we feel pretty good and like about sending patients home, and we never send them home too early, and we never want them to stay longer than they actually need to. So a lot of the times we'll be like, this test doesn't need to be done in the hospital. We could do that as an outpatient. Like, we don't need to keep them here over the weekend to, get a scope. Like, they can do that outpatient. And then, so that's that. And then in terms of what dermatologists do, like hair, skin, and nails, they do a lot of infectious disease work. That's what I'm interested in. They do some malignancy, like cutaneous T-cell lymphoma. I was interested in HIV malignancies a lot in medical school. So like Kaposi sarcoma, we play a role in that. And yeah, I love dermatology. It covers like a lot of inflammatory conditions, infectious conditions, malignant conditions. I think there is a large reputation that it's a lot of like aesthetics and things like that, which is like, I think it's true at some programs that they might be getting more aesthetic training, but a lot of the large academic medical centers, there's like a certain number of like cosmetic hours that you need or something. So like usually at these large academic medical centers, you're basically just getting the minimum that you need, versus maybe some other programs are doing more aesthetics. But yeah, at the academic centers, you're spending more time inside like the inpatient rotations, like on the inpatient dermatology consult services, doing a lot of complex medical dermatology, seeing a lot of, like I mentioned, like hidradenitis suppurativa, CTCL. So it's a lot of cool stuff. I think a lot of it gets overshadowed by a lot of the skincare and all the glitz of it. Yeah.
Yeah, I was gonna ask you specifically why you chose dermatology, but it sounds like you pretty much explained it there, so we could skip over that question.
Yeah, no, derm's the best. I really like it. It's yeah, like I mentioned, I'm really interested in HIV malignancies. HIV was actually like the Kaposi sarcoma was like identified by dermatologists, so there's like a historical significance to it as well. So.
Got it. All right. Could you tell me any advice or any tips for pre-meds to help reach to the point where you're at right now? Like anything that you came upon and you're like, wow, I wish I did that better. Something, or any just niche tips. Like I've heard some doctors say, oh, we should read more, or some people say you should watch Grey's Anatomy more. They say that as a joke mostly, but yeah. Do you have any tips?
I think what I could have done better as a pre-med was really try to find what I was actually interested in, and I could have done a better job, like shadowing different doctors. And I think I was limited by that. I was also like working like full time while I was a student, while I was doing research, like helping my parents and things like that financially. So that kind of limited me and like how much I could shadow. But if I could do it again, I would probably try to shadow a little more just to get a better idea of what specialties I'd be interested in. And then try to build a personal narrative that makes sense and is cohesive. And like if I say something, I really want to demonstrate it. So if I say I'm interested in medical education, but I've never taught a single student anything, that's kind of, it's incongruent. So like going to residency applications, medical education is something I'm really interested in. So I spent a year, like my first year of med school, doing like a medical education research year that was like integrated in our curriculum. Yeah. So that made sense. I was able to create a skin of color curriculum at my med school. So like it all made sense when I said something. But if I just said I'm interested in medical education, and like I said, never taught a student, never did anything medical education related, that would be a little hard for the reader to kind of believe. So for pre-meds, like if you say you're interested in cardiology, like maybe work in a cardiology lab even if you don't publish anything, I think doing basic science as an undergrad, it was like one of the best experience that I was able to do, because it just was able to help me like think really deeply about even one specific, like molecule. So I love doing basic science. So I always recommend pre-meds to do basic science. But I do have like an interest in research, but also like do community service that surrounds, cardiovascular health, like going to screenings. I don't know, just make everything very cohesive. Like if you say you're interested in Latino and Hispanic health, like maybe, like volunteer and shadow at like the Hispanic clinic or something like that. Just so it all makes sense, and you have a package. Like when someone reads your medical school application, everything should make sense. Like there should be no question marks. Even if you have a 3.2 GPA or whatever, but you have like 1,000 volunteer hours, like at a specific organization that's been longitudinal, and I can tell you're like really passionate about that. I care about that more than like the 4.0 GPA student.
Got it.
Yeah.
And I know some medical students have been on like admissions committees. Have you ever? Yeah.
So I interviewed med students like throughout my 4 years case. So that was one of like my favorite things to do, honestly. And they would always give us like a food voucher, which was really nice too. So I've been able to like read tons of applications from like pre-meds. And I think the thing that stands out to me are like students who are really thoughtful and insightful in everything that they do. And that's something that I didn't do as a pre-med, I don't think, as well as I could have. Like I said, I kind of just took any opportunity that came my way, being more intentional about the things I say yes to and the things I agree to do. But yeah, I mean, everything worked out. I'm very happy with like how everything happened. But I just be really thoughtful and intentional, because like I said, college is 4 years as well. So obviously do your best in all your classes. Like don't let that fall behind ever. But really be passionate about like everything that you're doing.
What are some thoughts about this podcast? Anything I can improve on? Something, maybe questions I should have asked, but I didn't ask.
No, this was great. I think it was super conversational. You sent me questions ahead of time that I probably could have looked at a little more. Shorter answers. I think you were super flexible. Like I emailed you back today and you were able to get on today. So I could tell you're really committed. You had like super contemporary questions, like with social media and like research, and everything was just very insightful and thoughtful. So I think you're doing great. I think, just keep interviewing people. I think this will be also like helpful for you to like, as you go through your medical journey. I know you're accepted to medical school already, but like also like thinking about the kind of physician you want to be in the future. And I know it's a very like big picture as like a first year college student.
Yeah.
But it's like a lot of people, yes, they do clinical medicine, but it's like medicine plus, like you're going to do a lot of different things. And some people don't even practice clinical medicine, and that's okay too. But it's like, what makes you really happy, and what makes your life, worth living, like for me, it's like research and mentorship. For other people, it's like being outpatient. For some people, it's being in the OR, and it's different for everybody.
Could I ask you what your favorite quote is?
Oh, my favorite quote. Oh my God. There's one I like, and I'm gonna like butcher it, so let me find it.
Okay, take your time.
It's the physicians are the natural attorneys of the poor, and that social problems should largely be solved by them. So that's by Virchow. I like that one because I feel like as physicians, a lot of the things that you're going to see are very like social determinants of health related. And it's easy to just brush it off as that, like, oh, this is related to social aspects. There's nothing really I can do as a physician. But like I said before, when you're thinking of your future career, you can be a big difference to like a low-income community. You could go back to these communities that you grew up from, and really help shape the health of that community. And it's been shown in research, like, to increase life expectancy when people do that. Because a lot of people will be motivated by money to go to, or like by location. Like a lot of people want to be in Manhattan. And obviously there's a lot of need in like many different regions of New York City, but a lot of people maybe want to like work in the Upper East Side or something like that. Especially in dermatology, like a lot of people want to do aesthetics. A lot of people want to be in these like LA, New York, Miami, but there's a large swath of the country that needs dermatologic care, predominantly people who are low income, and you could provide free dermatologic care for them. And that comes obviously at an expense to you. And, you know, sometimes you can negotiate that with an employer and things like that. So I think as physicians, a lot of people are ego driven. A lot of people are driven by like money and things like that and status. But if you're just reminded on your why, like why you went into medicine, which for me was because I grew up poor, I want to go serve those communities. You can make, and I know I can make a big impact. Being able to being a Latino doctor who speaks Spanish, being a gay doctor who understands LGBT stigma, being first gen, being able to mentor, you know, first gen students, you can directly make the impact that you want to see in the world. Even as a first year college student, like you could mentor high school students, you know. There's a lot of change, and I also believe, you know, medicine can be a highly toxic place. So just showing up and being a kind, empathetic person changes the ecosystem that we all work in. And now as trainees, you know, we are under supervision from attendings, but one day we're going to be those attendings. So how do you want to show up?
This is AP Med, and we just interviewed Dr. Devin Barzallo. And a theme I would give for Dr. Devin is don't let your ego speak, make your actions speak louder than your words.